My name is Suzanne Zitting. I'm presenting my project for the leadership course for the spring semester and created this PowerPoint so that we could kind of go through the reasoning that I developed my project. So in our surgical department, I determined that there wasn't any in-service training specifically for our surgical department. We do training through Relias, that's an online platform throughout our facility, and that accomplishes the goal of continued education. But I wanted something that was specific to our equipment and our needs. So, like I said, I noticed that there was a lack of tailored training and wanted to make sure that we could impact the staff in a way that was meaningful and relevant so that we could make sure that they were competent in the surgical skills that we expect them to perform. So my rationale for developing that was that according to all of the research that I did, and I'll link that in a reference page at the end, it is very valuable to have consistent training. I found that employees that continue training have improved outcomes immediately after the training, but if you do it consistently, they have improved outcomes over the course of many months. So we wanted the improved clinical competencies and focus on the high-risk skills, and the transparency and accessibility. I wanted to make sure that we had a proof that the training was occurring and that it was accessible to all of my staff. So I'll explain how I did that. So the purpose was to strengthen our skills, to promote the staff's accountability, that they would be accountable for the skills that they know they should have. And when we've got their names signed to the training, then that indicates that they are accountable for doing that skill appropriately. I wanted to have a culture that was continued learning and professional development, and make sure that it all aligned with our organizational priorities, which one of our goals in our organization is to be the best place to receive care. And I believe that we are that if patients can trust their surgical staff to have the most up-to-date skills. So in collaborating and creating the content, I addressed our Chief Nursing Officer, Ashley Reynolds, and she acted as my mentor in this project. And we looked through evidence-based topics of things that would be most effective in the OR, as well as I went throughout the OR gathering data like equipment, skills that I felt like needed an annual training on. And together we shared the decision making of putting together a guideline of things that needed to be taught throughout the year. So we got on the AORN website, that's the Association of Perioperative Registered Nurses, and used a lot of their guidelines to help us determine what we would use for that. Okay, so in the development of our training calendar, I decided that I wanted to use Excel as a platform because it's easy to use, I can make changes quickly, and I like the many tabs. I have a million Excel type of documents that I share throughout my department. And that way I could have a tab for this year, next year, and the following years. And the instructor area has some drop downs on this spreadsheet so that I can drop down, quickly select who the instructor was for each training, and mark the date completed, and then list the attendees. So as you can see, I've selected a different training topic for each month, and we went ahead and got started in March because my goal was to be ready to begin in April once this calendar was complete and the project was complete. But because I had it done a little bit early, we went ahead and got started in March so that I could evaluate the efficacy of having this training calendar. And then I posted it on my SharePoint for the surgery department. It's in that first folder, proficiency training. And because it has electronic access at all times, people are able to get on there. I can make updates. It allows for excellent communication. People can, if they say, hey, what's our training next month, they can get right on there and look. And then it helps with our compliance so that we are compliant in doing a training every month and signed off on it. So I talked a little bit about the implementation, and as stated before, we got an early start on the implementation and oriented the staff to how we were going to do the whole process. I kind of had a stand-up meeting with everyone, taught them where to find it, how to access it, and then we went ahead with our March training. I provide the leadership support in helping with the training, and as you saw, each month is a different instructor. I will actually be selecting the person that is best suited to do that training, and I also will be making sure that one of my nurses or surge techs will have a training to do each year, and I think that that will help develop their professional skills. So I observed some really positive outcomes just with our very first training. With what we were doing, the staff talked about that they had increased confidence in the training that we were doing. They were less concerned about if they were using the equipment correctly. We were able to collaborate as a team in doing it, and then in that way, I felt like we had some good departmental engagement. So in conclusion, I felt like our learning outcomes were aligned with the course learning outcomes. The patient-centered care training, in fact, almost all of them are patient-centered care training because it's all in an effort to improve our skills with the things that we do with our patients, and then improve our clinical judgment, have effective communication, not only with our patients, but with one another so that they know what kind of training we're doing at all times, and offers compassionate and professional care because I will have staff that is skilled in the things that they need to be doing. I hope that the long-term impact is going to be improved staff and patient outcomes and continuous learning. So as well as leadership, I felt like having each staff member do a portion of the training one throughout the year, it helps them develop their leadership skills. And so I'll link my references on the next slide, and I appreciate the time I have had in this course. I feel like I've learned a lot, and I hope that this has been helpful.